tight with diaphragm. So the liver actually will occupy a lot of space. It's a very big organ that will occupy the right hypochondrium and it will cross to the left side up to a mid-clavicular line. Okay, so it will cover partially part of the stomach and it will cross the epigastrium. Its lower border will cross the epigastrium and it should not, once it gets to the right rib cage, it should not be lower than the rib cage, okay? So a healthy liver should not get lower than the rib cage. If you palpate a liver that gets lower, either there is ptosis, either there is hepatomegalia, okay?
What's that?
A big liver, that's pathology, okay? Like splenomegalia, like an enlarged spleen, this would be an enlarged liver. And actually, hepatomegalia usually correlates with splenomegalia, okay? Because if there's hepatomegalia, then the blood flow from the organs, the peritoneal organs, will be disturbed. So the spleen starts getting enlarged as well because it's a vascular organ, the spleen. Okay, it has immune functions of cleaning blood, etc. Okay. So several things here. Palpate the lower border of the liver. First of all, I'm going to make sure that I don't palpate any mass or anything weird and that it is not painful. How do you feel it? Is it sensitive? Okay. What I feel here is tension from the oblique muscle in the attachment to the ribs, but also it can be a reflex of the gallbladder. Okay, so I don't know yet. First, I'm just doing some palpation of the lower border. Okay. Then, what I'm going to do is test viscoelasticity of the liver. It must be very viscoelastic. A healthy liver is viscoelastic. It lets me in and it brings it back. Okay? Like a viscoelastic mattress. It's perfectly viscoelastic, this liver. Okay? Now, what I'm going to do is look for the gallbladder. So, in order to look for the gallbladder, I will draw a line from the umbilicus towards the rib cage at the same place that a mid-clavicular line on the right crosses the rib cage. This is the theoretical landmark for the gallbladder. But actually, the gallbladder is healthy. I should not be able to palpate it. Okay? If I palpate it, it means it is congested, there's inflammation, or there's gallstones, or there's whatever, or there's a tumor. If I feel it very clearly, if I feel something hard, that is a red flag. Okay? They must go to the medical doctor and have ultrasounds or whatever, okay? So what I'm going to do is that in that landmark, I'm going to get inside. I will ask him to bend his knees, please. And I will do Murphy's test. It means breathe in, please. Breathe out. Is it painful? No. Okay. If it's painful, then Murphy's test is positive. When he breathes in, what he's doing, look, I'm doing a fixed point, and he's pushing his liver and gallbladder downwards. So I'm compressing the site of the gallbladder. So if it's painful, acute painful, or he cannot even breathe or speak, it's a positive Murphy's test, and then it means they need a differential diagnosis from a medical point of view, because there might be gallstones or whatever. Okay?
So it's fine with a little bit of tenderness when you...
Yeah, it's normal. Tenderness is normal there, and even with Morphy's test, with the in-breath, it can be a little bit more sensitive, but it's not a red flag. But at the same time, it's telling you there's some nociception. There might not be pathology, it's not enough to send someone to ER, but there's nociception. So for us, that's important. Okay? I repeat it. There's a line from the umbilicus to the rib cage at the same point where the mid-clavicular line gets to the rib cage. That's the landmark. So I get in, breathe in, breathe out. Okay. What I can also do is widen my handling and see how the liver behaves during deep breath. Breathe in. Okay, it goes down smoothly, and during the out breath it goes up. Perfect. I can do it like this, or I can do it like this again. It moves perfectly well. Okay? So I'm testing how it moves regarding the rib cage during in-breath and out-breath. I could also listen how it moves from outside the rib cage. Okay? I will ask my patient to breathe in and breathe out. And I will see how the hole behaves. If there is tightness, restriction, I feel perfectly that the liver is being pushed down smoothly, and then it goes up. Okay? I don't feel any defense from the rib cage or whatever. It's a smooth movement. Good. So how to test the liver? We test suspensory ligaments, we test lesser omentum, we palpate the lower border, we palpate gallbladder, we test viscoelasticity, and we listen and test how it moves during deep breath. Okay? So if he has any problem, it's not the liver, because it moves quite well and the texture is right. Okay? So let's practice, but I want you